To Supriya. Supriya is going to show us a few cases on PHPV.
Sorry. Yeah. So I'm just going to show a few cases of PHPV. As you can see, the children can come to you with leukocoria, decreased vision, tractional retinal detachments, or vitreous hemorrhage. This was a 2-year-old child with leukocoria, who ended up with on B scan. You could see the stalk from the disc to the lens, vitreous hemorrhage. So what we did in these cases was a 23 gauge vitrectomy, and basically we did a lens sparing vitrectomy. Of course, an IOL calculation is always done for these children in case there's some lens touch, and you may need to convert it into irrigation aspiration and put in a lens. So this was a bimanual dissection done under the microscope, and you tease out the membrane. It's like a Weiss's ring. Tease out the posterior tissue to behind the lens from the posterior capsule, and then cut it. And once it gets cut from the posterior capsule, then you can just trim the stalk. This was we were lucky, it was a very fibrous kind of PHPV where there was not much blood. And you can see this is the stalk from the lens to the this, and post surgery it had resolved. This is the second case where a 3-year-old, again, the stalk from the disc to the posterior capsule of the lens was there, but there was no cataract. So the challenge in these is to try and retain the lens. So anterior vitrectomy was done, again bimanual under the microscope, where you tease out the membrane from behind the lens, push it posteriorly, that gives you the cleavage point, and then you can just cut it with your forceps. So this is not a posterior polar cataract, it's just the attachment of the posterior tag. And once you release, you can see how it falls back. And then it was a core vitrectomy was done, and this fibrous connect to the disc was then dissected using a cutter. This was also not very vascular. If it is, then you have to make sure that you cauterize before you go around cutting and trimming it to the disc. And then a core vitrectomy, something like an ROP. You don't have to be very aggressive in your vitrectomy. A core vitrectomy can be done, and a fluid air exchange was done. This is a 2-year-old child with leukocoria, and this child had like a medusa head appearance, multiple tags behind the lens as well as on the retina, causing a macular detachment. This was also a lens vitrectomy. So similarly, we did a vitrectomy just behind the lens, pulled the tissue from behind the lens. These can be vascular sometimes, and you have to ensure that you do a cautery. Otherwise, it could just bleed into the eye and make you lose your plane of treatment. So here, as you pull the with the forceps, you pull the tag posteriorly. You snip it with your scissors. And then using your cutter, you can just trim the tag, and then come back and do a complete vitrectomy. Because this patient had a macular TRD, we had to do a more extensive vitrectomy and release all the traction from the retina. And once you release the traction, then the retina falls back into place. So there is some tag here, fibrous tissue, but it was not in the central pupillary area, so it was left alone. This is the pre-op B scan, and you can see in all these 3 patients, the retina remains well attached, and it's been a few years of follow-up, and none of these children have developed cataracts yet. So I mean, it's easy doing a lensectomy or a cataract surgery, but the idea was to try and maintain the natural lens in these children because they were just 2 and 3 years old, and we've successfully done that in these children. Yeah, thank you.
Supriya, that was very nice, though I just saw part of it because I was arranging my presentation. But what I wanted to say, do you get many a times cases where a PHPV has been mistaken for a cataract and they have done cataract extraction and come to you with a bleed?
Do you get many cases? Sorry.
Is it echoing?
Yes, yes, yes. That happens often if an ultrasound careful evaluation
One second.
preoperatively
My
is not
question
done.
was
Yeah.
that many a times PHPV gets mistaken for a cataract. A cataract surgery is done by somebody and the patient lands up with a bleed, and then that's how the patient presents to us. So that's what I was asking Supriya if this she has encountered at any point of time.
So these three children that were presented, they all had a clear lens. So it was very easy to diagnose PHPV in them. But yes, we've had children who've come in with just leukocoria and then was told congenital cataract, taken up for surgery, ended up with a messy surgery, a lot of bleed intraoperatively, and then sent to us with vitreous hemorrhage. So yes, we've had that.
Uh, there's one question I wanted to ask you. See, PHPV generally is unilateral. It's not a bilateral condition. So, what do you do in terms of rehabilitation for these children?
So these children, of course, they undergo extensive amblyopia treatment post-operatively also. It's sorry.
Speak into the mic.
Yeah, so these children do undergo extensive amblyopia treatment post-operatively also. It's not that, they're operated and then left alone. So they do come back for rehabilitation to the low visual aid clinic.
No, what do you do? You use
So
you
patching, or depending on how their vision is.
do you give them contact lenses because they are very small. So the contact lenses have to be managed by the parents.
Yeah,
And
yeah,
obviously, the child can't do it. It's unilateral. So the mother has to learn to put it, remove it,
yeah.
then, to look after the child. So have you come across some pitfalls that is there in the rehabilitation of these children?
So, I mean, unlike ROP where you are, it's bilateral and you can give them glasses, this does become a challenge. But I think the parents are quite made aware of, and if we educate them well, then they do come back for follow up and they do follow the strict regimen of patching and contact lenses.
Because I have a very bad experience with these mothers. They do it diligently in the first year or so, then it goes on a downslide, and the child invariably comes back with a convergent squint later.
Yeah. Then you can always go in and put in a lens also in these children. I mean, if you've left them a fake it, then you can always put in, once things have settled down, then maybe in a year or two, you could put in a intraocular lens,
Scleral
SFIOL.
fixated.
Yes, SFIOL, yes.
Any other questions? Paritosh?
Any incidents of cataract post surgery, and what is the longest follow up you have?
So in these three children, no, but it is, yes, sometimes if you're not able to separate it from the posterior capsule of the lens, then intraoperatively a lens calculation is always done so that you're prepared for it intraoperatively itself. If at all there is a lens touch, then you convert it into. So the option of, having that is kept, but you hope for it to not happen. So yeah.
In vitrectomy surgery for PHPV, what are chances of vitreous hemorrhage and how you tackle it there? During
Sorry.
vitrectomy for this PHPV,
Hmm.
how you tackle if there is some hemorrhage?
So you have to cauterize it well. I mean, make sure that every vascular tuft that you see, the feeder vessel is
Shivering
cauterized.
because of the
And I
cold.
think if a well done cautery,
It's
then
very cold
you
here.
can try and prevent it
Voice also
and
touches
not cut it
Shiva.
beyond the cauterized edge. Then you can try and prevent it. But there are times when you've had a bleed and you've had to use PFCL and increase the intraocular pressure. So yes.
Thank you, Supriya.